The recently passed health care reform bill, according to the Congressional Budget Office, which is the official scorekeeper, would substantially reduce at least the federal component of cost in terms of the deficit. The biggest idea to slow down health spending is to make across-the-board cuts in payments to various providers, hospitals, home health providers, nursing homes, and so on, providers that offer services to Medicare beneficiaries. Every one of these ideas that are in the law assume that all future Congresses will in fact carry out what this last Congress said to do. And I think that's one of the big issues. As everyone knows, members of Congress are politicians at heart. And politicians love to be able to say that they're giving you something, and they hate to have to admit that they're taking something away. So it's very difficult for politicians to make a cut in Medicare or make a cut in anything. The law has a number of ideas that are, frankly, they sound good, they're speculative. We don't know whether they work, but they're worth trying. Those weren't scored as big budget savers. The main budget savers were in fact these cuts in Medicare, and so you have to ask yourself, will that actually happen? Will future Congresses actually continually cut 4 or 5% off of the payment rates to hospitals, not just this year and next year, but every year into the future? The answer is no. There's a formula that requires Congress to, or requires the Medicare program to cut off a certain amount of money every year from physician fees. Since that was in effect, Congress has overturned that law, and the accumulated debt that hasn't been sort of paid off here has added up. It's not surprising to anybody who thinks about politicians. It is not surprising when you realize, as everyone would, that you simply cannot cut 30% out of payments to physicians and not seriously harm the access to essential care for seniors. You cannot do it. Well, this is the same exact position that the health reform law has placed future Congresses. We're going to spend a lot more money than the official scorekeepers said we would spend over the next 10 years and beyond. So if you're going to deal with a Medicare program, you've got to put Medicare on a real budget. And one of the ways to do that, one of the ways that was recommended, for example, by Alice Rivlin of the Brookings Institution and Paul Ryan, a Republican congressman from Wisconsin, their proposal was basically to provide a subsidy for insurance that was relatively fixed. It would grow over time. It would be adjusted according to your health status. If you were a sick person, you were going to use more services, you need a bigger subsidy, because after all, where does the subsidy go? You're just the patient. The subsidy goes to the practitioners who provide the services, and obviously they need to be paid more for a sicker patient than for a less sick patient. If you do something like that, where you recognize that there really is a resource constraint, that we live in a finite world rather than a world where you can do anything at all times, then you will begin to come to grips with our spending problem.